Everybody, I'm Dr. Nadir Qazi. I'm a skin restoration specialist in Newport Beach, California. I do a lot with acne, with scars, and with pigmentation. I want to walk you through this particular patient. This is an Asian patient who had complained of some boxcar scars, particularly in the temples. He had tried a bunch of different treatments before in the past. Nothing really seemed to work. So I was really happy to see when I saw him just a few days ago that we had gotten significant improvement in the temple area, which was the biggest problem area for the patient. So I'll walk you through just how I did this, and hopefully you could be able to get some sense of how we could treat these kind of scars. And if you have these kind of scars, you can see that there's a process where we could improve these in just a few months. Really, it's going to continue to get better as we do more sessions and continue to work on it. When he came in for his follow-up, we also ended up doing some more TCA Cross, some Bellafill, and some laser for that area. So I would expect the next time I'll see him, it's going to be really, really good as well. He's still in the middle of this process, of course. You saw yesterday I had that patient who was kind of closer to the end of the treatment. This is still kind of in the middle. Hi, Joey. How's it going? Crazy about the market crash. Yeah. Yeah, it just goes to show a lot of these things are just a house of cards. It's really, really easy for these things to pretty much tumble. And it's also kind of interesting because people are always really obsessed. Every time I'm like at the gym and things like that, everybody's just always talking about like their stock portfolio, and like everyone's just like obsessed with it. And it's like, it's out of your control completely. And one day it could just like, wipe out $1 trillion on a company, and it had nothing to do with you, not even your fault. Interesting, right? That's why I kind of just focus on the things I could control and like get really, really good results. And otherwise, it's like all this other stuff, sometimes it's out of your hands. And a lot of times I think it's a bit of a Ponzi scheme. Hi, saying, can I do acne scar treatment on spironolactone? Yes, you could. There's no problem. Actually, it's better that way because we could control your oil production and control your acne, which will end up getting us a better result. I'm actually going to lower this result because I think it's kind of hard to see with the way it's formatted over here. Let's see if you can see it better this way. Maybe, actually. How many sessions in this case? So basically, we did one combination session a few months ago back in May. It says 2024. And then we ended up doing, actually, I'll just make this really big so you guys can see it. I'll hide myself for a little bit here. So you can see a little bit better because I think it's harder to see with that formatting. But yeah, so we ended up doing one bigger combination session with Subcision, TCA Cross. We did some laser. And then I had him come back in and we did a little bit of Bellafill, TCA Cross again. And we've done TCA Cross about 3 times at this point for this patient. And now he came in a few days ago. We ended up doing some laser and some more Bellafill for him. So a few different steps really to improve that volume loss, and the texture, of course. The temples are, interestingly enough, like an area that a lot of people get concerned with, and they think that you can't solve, but there's definitely ways to do it. There really are. It's more about being patient. You don't want to really overheat the skin. You don't want to use too much with like high intensity lasers, especially in the temple area, and then especially with this patient who's East Asian descent. You really would run into a lot more problems if you did that. So that's why I focus a lot on manual type of things like TCA and also things like Bellafill or Subcision. All those are ways that we could actually lift up the scars and improve them over time. So I don't want to just like overheat the skin. That's why I didn't end up doing a bunch of laser sessions on this patient, even though a lot of people would say that this just requires multiple sessions of laser. It's not the case. You could actually do this with, we got this point, which is a single session of laser. And then, yes, we did do more things like TCA and Bellafill, but that's better, it's safer for the patient. So instead of just doing over and over laser sessions, which could have caused more problems. So I didn't realize there was a delay on some people's formatting. Hopefully it's better now. Let's see, hopefully you guys can see How long do you have to wait after Accutane to start treatments? We could do some treatments while on Accutane. It doesn't have to be that we have to wait it completely. Really, we could actually end up, especially if you're on low dose Accutane, it's okay for a lot of treatments. Depends on how aggressive we have to go, what kind of scars you have to do, or what kind of scars you have. But it is possible to do treatments even while on Accutane. I'm going to pull this a little bit differently. What treatment would you recommend for smile lines? Bellafill works really well for that. Bellafill is a really, really good product for the smile line area. Usually you want to make sure that you correct the cheek area first, and then you could kind of put some small little micro droplets of Bellafill in the fold there. Again, an area you don't want to put too much in there because it could really look really stiff and unnatural really quickly. But I do like Bellafill. If you want to do hyaluronic acid fillers, then I usually do ones that are a little bit more flexible. So I don't usually do things that are particularly too stiff. I don't love the Juvederm line of products, for example, in the nasolabial fold, especially. I don't like it anywhere, but especially in the nasolabial fold area, because you could get more migration there. What other effective medicine for acne besides Accutane? You could use topical creams like antibiotic lotions. You could also do tretinoin, which is the topical retinoid. So topical vitamin A, that will also help for the oil production. And I was talking about the antibiotics, like topical antibiotics, like topical clindamycin, or you could do like some sort of topical antimicrobial, like dapsone would work really well. Sulfur wash, those are all good options there. And then you could also use the Accure laser. The Accure laser is working just like Accutane, normalizing the oil gland, shrinking the oil gland, so you no longer have those breakouts after a while. Nana saying I want to come from UAE. I have a lot of patients from the UAE. I would be happy to help you out whenever you're ready, look forward to it. Really, I pride myself on being able to do these combination sessions, really getting excellent results even after a single session. So no matter where you come from, I'll be able to help you out and work on it. I know I've missed a few other patients here, so I'll try to get to them. I hope you could come to the Philippines. I can't rule anything out, but it's not going to be anytime soon. I'll just tell you that. I really have a lot on my plate over here right now. But someday, if you're open to it, I could come over there someday. But in the meantime, it's going to be a while. So so feel free to visit me over here. A lot of our patients come from overseas. How long? I think a few people have been asking about the Accutane question. I could do treatments while on Accutane. It's actually possible to do it while on Accutane. If it's a lower dose amount, usually it's okay to do with isotretinoin. But if I'm doing like more like highly aggressive laser treatments, then yes, we would want to wait for you to not be on that higher dose of Accutane. But sometimes it's just a matter of like microdosing Accutane just for a couple times a week or so, and likely that's actually going to be beneficial because it's going to control your oil production and control future acne, which is great. Does Sculptra leave nodules or scars? Not necessarily, no. It's about how people inject it. I typically inject Sculptra a lot deeper than the way they train it to be injected. So I actually go down to the bone, and I found it to be really, really effective that way without running into any problems. We could get the volumization effect, we get the collagen response, and we end up just getting a really beautiful result that way. So I personally prefer that way, and I don't run into any problems. My partner is a plastic surgeon. She does facelifts on patients who have done Bellafill on, Sculptra on, and she has absolutely zero problem doing facelifts with those patients. So there's just a way of doing it. I think that it's possible that a lot of places aren't doing it that same way. You also want to dilute it. You want to make sure that it's dilute. It's not going to actually be like clumpy in the skin. So there's a few variables there with it too. You want to make sure that you're putting little droplets along the bone, not just putting a bunch in just one spot too. So that's another aspect there. Does Kybella work? Well, it does destroy fat. One problem though that could happen though is that sometimes what ends up happening is that you end up having loose skin after it though, because as you destroy that fat, you may notice that your skin starts to sag because potentially there's now that there's no longer this fat that was holding up that skin, you could actually end up just getting some laxity afterwards. So a lot of times you do want to do something to combine it with skin tightening. Usually I don't do Kybella, I do more the Microlipo, just tiny little bits of fat removal, and then we go inside and tighten the skin inside there. What treatments did he do? This patient did TCA Cross, he did a CO2 laser, and then we also did Bellafill, Subcision as well. And we've done a couple of times, we've done some TCA Cross for him. Did this patient get Bellafill for his acne scarring? Yes, we did do a Bellafill for him. So I'll pull it up a little bit larger. You can see it a little bit closer then and get a better picture of what's happening here. So there is clearly volume loss over here. And the reason why I'm saying it's clear is hopefully everybody could see it like kind of zoomed in here. But you can see where like he has this healthy tissue, and then there's this big indentation, like really of the fat destruction. There's skin destruction and there's fat destruction over here. So yes, could we get some of that scar tissue around it, the thick edges, we could get that softer, but some of it is also just like healthy tissue and there's fat there. We don't want to just like burn down all his natural fat. He's also East Asian descent. We can't just bulk heat the skin, especially in the temple area. It doesn't heal as nicely. So instead, what we did was we broke up the scar tissue, helped pop it up, and then place some Bellafill there in those pockets where there's some fat loss there. And that helped out a ton. So fat loss, really big factor for scars, really important for us to solve. In this case, we used Bellafill. Other options could be Sculptra, potentially also fat transfer, all options for something like this. Would you do excisions in the temple area? Yes. In this case, it wouldn't be too helpful to do excisions, but yes, we could do excisions in there. What additional treatments do you plan to do for this patient? So when he came in on the day that we took this photo, so just a few days ago, you can see there were still some thick edges of the scars. And so I ended up going back with a laser to soften that up. I did a little bit more TCA at those ice pick scars as well, ice pick and boxcar scars. So that's what I ended up doing, which is going to help him out. So I'd expect in probably 3 to 6 months, it's going to get even better. He's aware that it's going to take some work because it's a sensitive area. Can't, again, overheat the skin. You can see his pigmentation is excellent. In fact, it's actually better than it started, which East Asian patients, we have to be very, very careful. This particular patient is Vietnamese origin. And so there's a little bit more pigmentation, actually, I find with Vietnamese patients in particular, of East Asian patients. And we just have to be exceptionally careful with making sure that we're not bulk heating the skin there. How long do I wait after Accutane completion to come for a laser as East Asian prone to PIE? Talk to me. I mean, I could do that while on Accutane. It's okay. It depends on the dose though, but it is possible to do it that way. What is the best treatment for ice pick scars in people of color? We actually put a video up today about that. So take a look at my page. You can see that. It's essentially a few different options. We could do excisions. We could do TCA Cross, and sometimes we could do lasers. Sometimes it's ablative lasers in some areas. Sometimes it's more fractionated lasers. So it's like there's healthy tissue that's still there, and we're more just stimulating collagen production. But in darker skin types, I'm really cautious when I'm using lasers. I'm trying not to use too much heat, not too much energy. It's not that I worry about like prolonged permanent hyperpigmentation, I would say, because it's just so rare with the way we would manage it. But like I want you to recover really quickly, get a really robust collagen response. What is beneficial for back acne scars? Those, a lot of times you have to manually put something in there. A lot of times you could do something like Bellafill would work out well. Sculptra is another option there. Janella is saying, is fractional CO2 laser will have a good result for oily skin. Then after a month, I will do microneedling PRP. Well, you should really control your oil production. I know that you said that you were in the Philippines. So go to somebody to prescribe you the equivalent of isotretinoin, Accutane, go on that. And really manage your oil first, and then consider doing something for scars like a laser session. Probably would not recommend microneedling though, to be honest with you. It's not going to help too much, but that's the way I would start though. I would go with controlling your oil first though. How much is something like this? How many sessions more or less, and what does recovery time look like? So we did a initial combination session. I'm not sure offhand how much it was, probably about $5,000 for that patient. And then we ended up doing some more Bellafill for him and TCA Cross. And so somewhere there's, some more volume replacement that we need to do. So it gets to, like that $7,000 mark a lot of times for something like this. And the sessions are a little bit different. First session was that combination session, and then future sessions were just TCA Cross as well as Bellafill. And then when he came in this next time in January right now, we ended up doing some more CO2 laser and TCA Cross. And I don't always do like more and more laser, especially in East Asian patients, but he tolerated it really well. His pigmentation was really good. He follows my instructions really well. He's indoors and does a lot, still wears a lot of sunblock. So all those are really good indicators that we could go ahead and do another laser session for him. And he's going to get a better result now. So good for him. Thank you, Jadre. Appreciate you. Jadre saying, boom, Dr. Qazi killed us. Thank you. If you do an excision, do you do a suture to close the wound there, or how is it done exactly? Well, it depends on the size of the excision. If it's like 1 millimeter or less, usually you just leave that open. It'll just close up really quickly. 2 millimeters, likely we will close it, 2 millimeters and above. Elliptical excisions, we always would close. So it depends on what kind of excision we're talking about, but 2 millimeters up, likely we would. So we would close up. Jeff is saying, have you heard of AviClear? It's a laser of 3 treatment sessions that's supposed to be a long-term cure for oily, acne-prone skin. I have AviClear, actually. I use mostly the Accure laser at my practice, though. I have both. I have AviClear and Accure, and I really like the software for Accure. And I'm totally independent from these companies. I'm completely independent. I don't even do like dinner talks or anything like that, actually. So I'm like completely independent. And I found that there was just less issues that I was having with Accure. Really, that patients really didn't have much with rebound cystic acne or anything like that. So it was helpful. They did say that AviClear was changing their software. I'm not sure if they ended up doing that or not, but if that's the case, awesome. But Accure was doing a great job with making sure that they had, constantly, feedback. I would tell them that we had to change this because potentially, it was a little bit too sharp of a pain, things like that. They'll double check the device, go through all those type of things. And it was like, let's make sure that's really comfortable for patients. It's awesome. And so I really like that, the fact that they were just really responsive. I'm up is saying, is the pigment control cream used for oil control as well? Yes, it is. That's correct. So we use that for oil control as well. And that's why I don't do other exfoliants or, anything else like a topical retinoid or anything like that. Someone's asking for me to make the image bigger for them. Sure, let me try to do that again. I'll try to showcase the scars again because I think it's the formatting somehow it's like getting cut off a bit. So hopefully it's a little bit clearer now. And I think this is nice because you can see just the fact that there's so much volume loss. If you go in really close like that, you can see that volume loss there. And there's this indentation. And really like the other thing that's really actually nice when you actually zoom in, I'll go zoom in on that before photo a little bit more because I want to show you something here now that we're here. So let me see if I could get something for you to see here. So if you look at this patient, you could end up seeing that there are actually these thick elements of the scar. So see that those thick elements there. And what we ended up doing for this patient was we ended up putting the CO2 laser on the surgical setting so we could actually smooth those down. And that worked out really well. And I do that a lot. Today I had a case, a patient that came in all the way from Portland, and she had just had very, very thick scars. I took an hour and a half, 2 hours, just tracing those thick elements of the scar until I could smooth those down really effectively. And it worked out really well. But that's actually what we have to do sometimes for these patients, because if you end up just only doing fractionated lasers and just phoning it in with just those, you're not going to be able to achieve the kind of results that we need to be able to get for amazing, excellent. Constantly, I want to get this like over and over and over again, where we can improve the skin quality at the highest level. Where was I? I was just trying to pull this a little bit differently. Sorry, 1 second. guess it wasn't cooperating. Sorry, I think that for the horizontal view, it wasn't working there. So sorry if I lost that there, but it should work now. Okay, so Mr. Mabriz is saying, how much for something like this? How many sessions more or less? And what does recovery time look like? Oh, I forgot about recovery time. Recovery time is mostly just going to be about the first 4 days. It's going to be pretty scabby, but really, you know, if we're using more ablative CO2 laser as this patient did, it is going to be about 7 days really for that. So expect really about 7 days of recovery. How does Bellafill work? So Bellafill is basically 80% bovine collagen and 20% PMMA. And that bovine collagen basically trains your body to make your own natural collagen around there. So it is a biostimulatory. And then you're asking about if there's a direct volumization. Yes, there's 20% of that is volume. And so that continues to stay there. So there is that effect where you have that 20% volume improvement there. For people that were just joining, this is a East Asian patient. We did combination scar treatments. We did TCA Cross. We did Subcision. We put some Bellafill in there as well. And then we did ablative and fractionated CO2 laser. So a few different steps really to achieve this. And ultimately it ended up being really, really great. Yeah, I am reading the live comments. Sorry, there was just a bit of a delay on a couple different formats there. So I did see some people's, but there was kind of a bit of a delay I was trying to solve if I could fix that without shutting down the whole live. Okay, so do you know just about acne scars or acne in general? Yeah, both. I mean, I suffer from severe acne, and I had, went through the whole journey. I did literally everything, pretty much everything that you could name. I ended up trying. Including like random herbal supplements and all sorts of things. So, yeah, if you have particular questions about it, I'll be happy to help you with that because I did a lot with acne. And most of my patients, of course, I have to control their oil, or not most, but a lot of patients have to control their oil, control their acne before I even do these treatments. So I'll be happy to help you out there though. Yes, it's me. I am live. Hi. People are asking about if that's really me. I'm never going to do like an AI thing to like pretend like it's me, just so you know. It's like, it's always going to be me. If I can't come because of whatever reason, I'll just put like a little announcement on my stories that I'm just not going to be able to come that night. But I'm never going to like have like a thing up there that's AI. I would just like hate that. Nui saying, would this be possible without CO2 laser? So, that's actually why I zoomed in a little bit there. You can see the thick elements of the scars. Those we do have to soften up though, and we had to soften that up with something like a CO2 laser or erbium laser. Those are both options there. That's something that AI would say. I guess that's true. You really should, like, if you look at it, the way that the market crashed yesterday, or just briefly, but it was kind of interesting. And I want you guys to look at this and you'll notice it. You'll see like how so many influencers, so many people were trying to get people to like stay with NVIDIA. It was really interesting. You can start to see like, it's like kind of really interesting. Like everything lights up like a Christmas tree when you like look at it that way. You'll like everything was crashing. And everybody was like it was like these random like influencers, like these tech influencers that would just like try to like hype up NVIDIA still. It was really interesting to see. It's worth looking at that actually. And so if you kind of go through and like one day you're flipping through stuff and you'll see that, it's worth like catching like where that propaganda is honestly, and just like seeing it. Like it's like kind of interesting to see it live as it's happening. And it's tough for people to kind of focus on where the truth is because there's just so much of it sometimes. Raspberry Connie saying, if someone has one acne scar that's small, would it just be the same price? No, I mean, that's likely something different. So we could take a look and see what's happening with one scar. If it's just like excisions or anything like that, I'm not sure. Let's see here. Dora is saying, hey, I've been using a new serum with Centella acetia, and it's healing and softening my skin, but my under the skin bumps are coming to the surface. What should I do? So it's likely that you're having a little bit more oil production. I'm not sure if that particular cream or serum is drying up your skin a little bit too much, like it's a bit of exfoliant or not. You may have to use like some sort of topical moisturizer. It sounds like it's causing something to have your oil glands to be a little bit hyperactive. For whatever reason, maybe because it's drying you up a bit. So first thing maybe would be just to use a little bit of lotion, something like Vanity cream is a safe one. But if it's still a problem, obviously just stop that cream. Can Bellafill migrate? It depends on how it's being placed. It depends on if you're, aggressively massaging it the first couple of days or not. But once it's integrated in the tissue, it's going to stay there and it's not going to move. Where it's at, it's there. So yeah, the way we place it is really going to be small little micro droplets and spots. I never just put a bunch in one area, especially if you're placing it too superficial and you put too much there. I think then you could run into problems where it just could potentially look really unnatural, more so than migrating. I think that's the biggest issue. Some parts of my husband's face look like this. What can be done to fix it? Well, a few things. We did subcision over here. So we went underneath the scar tissue, actually broke up the scars manually. We did CO2 laser for the edges of the scar. We did some TCA Cross as well. So we did that to help with stimulating some collagen production. And then we also placed some little bit of Bellafill in there. And I saw somebody was asking, I can't remember where it was. Oh, Max is saying, when do you use Radiesse and when do you use Bellafill? Sometimes you use both. So this is like one of those questions that they would trick us on in grade school. And it was like, sometimes it's like both. I hate those multiple choice questions because it's like, sometimes it's like, it depends, and in this case, we didn't need to because we didn't need Radiesse because I didn't need to tighten the skin. And I usually use Radiesse for like that skin tightening effect. So if it's like somebody with, if you feel like, especially like around the jowl area, the lower part of the face, and they're smiling, you see that there's this laxity, Radiesse works really well for that. So you could really get a beautiful process where you can stimulate collagen and elastin, tighten the skin. So that's usually what I prefer to do. But if it's more for like discrete scars, like this particular patient, Bellafill works awesome. In the temple area, it looks amazing. Triple X is saying, so a facelift is still possible if Sculptra is done properly. Correct. That is correct. My own partner does facelifts on that way. There's no problem there. Does the patient have to pass a physical check blood pressure to get this? Funny you should ask, actually. Interesting. I'm probably the only practice in the country, maybe one of the only ones in the world. I don't know anybody else that does it though, that checks blood pressure and heart rate before we do these treatments. And now 2 times I've had patients that have had like either like very, very high blood pressure due to anxiety potentially, or like really high heart rate. And sometimes it's so high that you just can't do the treatment because it's just like, it's so high and we have to reschedule it. So interestingly enough, I mean, it's not that we have to do these things beforehand because this is, minimally invasive for these treatments, but I do just double check it because I know that sometimes if we're doing these treatments, you could get more blood pressure, just from anxiety, things like that. And I want to make sure it's relatively normal, before we start this. I really want to make sure that you're safe as we do this. So just interesting enough, actually, I do actually check your blood pressure and your heart rate before we do this. And today I had a patient whose heart rate was in the 130s. It was sinus, it was just regular tachycardia, but like still, I checked the EKG, everything like that, and it's like his heart rate was in the 130s, and he was otherwise was like asymptomatic, and he just felt like he was really anxious. So tried to relax, and it still was really, really fast, and so we just can't do the procedure, of course. But like interestingly enough, I don't know anybody else that does it, but you'll ask people. And they are doing things with epinephrine sometimes, which could be really problematic if the patient's has high blood pressure or already is tachycardic. Just something to pay attention to. And we have like everything, in our practice to make sure that things are as safe as possible for us. But at the same time, I want to make sure before we even touch patients that it's safe. Has anyone ever had VTAC? No, not for this. I mean, I've dealt with VTAC before in my life a lot of times, actually. In fact, my sister actually died from VTAC. So I'm like, I pay attention to it a lot actually, but never had an issue like that over in my practice. I do have a defibrillator in my practice. It's like ready to go if we need to, but haven't had that issue. But that's why I check the heart rate, and then I make sure that everything's safe beforehand. Thank you, Triple X. Appreciate you. But yeah, so interesting that you asked about VTAC. Are you in the medical community? Dora is saying the serum doesn't have any active or exfoliating ingredients, but it claims a refined skin texture. Well, if it's refining skin texture, it probably has something active. I'm not sure exactly what it would be. I haven't looked into that product, but maybe something there. Let's see here. Ida Bet is saying, I've done TCA Cross, Subcision, Secret RF, and Matrix RF and have seen very little improvement. And WDYR, I'm guessing that's what do you recommend? I would hold off on these radio frequency and microneedling devices and instead double check. You know, one of my patients today had done Subcision 3 times. She said that the Subcision I did was totally different compared to anywhere else that she did it before. The laser that I did, she had done multiple laser sessions before. She said it was very, very different and just more focused on the spots that really were the problem areas. So it's just because they did those things doesn't mean that, you know, it's hopeless. It could be just the technique, the way someone's doing it. And I just definitely don't recommend doing things like radio frequency microneedling, things like that for scars, really. If you do a little bit of that when you do subcision for skin tightening, that's different, but really not going to help too much for scars. Hello, what laser for acne scars? It's not about the brand of laser. I know everybody's always talking about the brand of lasers. I know a lot about that. It's, you know, patients talk to me all the time about that during consultation. I guess not so much anymore, but initially they would, and they would say, you know, that they tried this brand or they went to another brand. Do you think this brand is good? It's not about the brand. In this case, also, it's not about the brand. You know, it's like not about the brand. It's really not. It's just about how you're doing it, the way we're using the laser. Very, very different compared to like anti-aging purposes when we're talking about for scars. Of course, for anti-aging purposes, it doesn't really matter too much either. The brand you're using, till you know, it's just a matter of like how comfortable you are with it, how ergonomic it is, things like that. Let's see here. Melissa's saying, I've tried everything with minimal results. Boxcar scars on cheeks. Should I try Sculptra next? And a lot of times boxcar scars do need a little bit of volume. So Sculptra is not a bad idea. The only problem with Sculptra, though, is that it could be a little bit, what we were talking about earlier, which is that in the superficial pocket, now you could end up getting those lumps, though. So, you know, it has to be pretty dilute, and then you're not going to get as much of that volume effect. So I usually prefer more like Bellafill, actually, honestly, for boxcar scars. What are my thoughts on tropoelastin? I know people are investigating it. I haven't really followed along to see where it's going right now. I mean, to be honest with you, I haven't really seen anybody showcasing that it's been like this wow effect right now at this point. But you know, I'm open to it. If somebody has more claims and like about tropoelastin and knows that it's gone further ahead, I'll be really interested in seeing where it's at. 12345 is saying, I'm in Denmark. Is there any clinic you know and can recommend here? My problem is ice pick scars. I know Dr. Emil is over in Denmark, so you could take a look and talk to him. He's over there, and see how he is, and you know, if he could help with your scars. Let's see here. I know I missed a few things. I'll try to catch up with everybody's questions. Appreciate all the questions, by the way. Thank you so much. I'm way behind in some of these. I'm up saying still blown away by the results in that female patient. I appreciate you, I'm up. And that was a patient that was really closer to the end of the journey. You know, she could still do some more things, but she's pretty much like just happy in life, and she's just she's ready to kind of move on from her scar journey. And that's pretty cool, right? Like that's a pretty good feeling that you could get to a point where you could just be like just done with worrying about scars. It's pretty cool. You know, I feel like I'm there, like kind of, you know, I feel like I still see a little bit here and there for myself, but like, I pretty much don't worry about it day to day, you know, and it's pretty cool that I don't have to worry about that anymore. But I still like to kind of like to always improve my skin quality a little bit and like just get it to like it's brighter and like just like things like that. And so it's nice. Like I don't have to worry about like the scar portion of things. And I just kind of focus just more on just like overall skin health and like just making it like just like look like more hydrated, and that's pretty fun for me. The serum contains 3% niacinamide, so I don't know if that contributes to anything causing those little bumps underneath the skin. I doubt that's the case, honestly. I'm not sure if that's really the reason why you're getting those bumps. I'm not sure. Maybe just stop doing the serum. You know, is it really worth it if it's causing those little bumps? And also sometimes there's a bit of a process where if you just start a new skincare product, though, maybe you're just having that issue right now. So really consider just adding to some moisturizer like Vanity Cream. Rachel's saying, I have scars worse than that, but I'm a person of color, so I'm scared of hyperpigmentation left with laser. What do you recommend? You may not have to do laser. You could do Subcision, you could do Bellafill or some sort of volume. And then you could also do something, you know, potentially like a lighter laser, like erbium laser, for example. That could be all, those could be all options there. But you don't necessarily have to do like an intense laser for scars. TCA Cross also would be helpful. Will patients still be able to use verteporfin if they had scar treatment in the past? Yeah, I mean, essentially, if you could do something that we could excise, if we could take out the scar tissue, and then we could place some verteporfin in there, then that's what it'll be for. So more for like those bigger boxcar scars, and what I'm going to have to be doing is with more surgical scars at this point for the body. The FDA has a waiver for me just to allow it for the body portion, so I could do it for more surgical scars or bigger like scars that don't have much tension. So I can talk a little bit about that for you down the line, but it's not going to be like a problem if you had previous scar treatments for us to do verteporfin or something. Sana is saying, if someone has a mix of box scars and ice picks, what would you recommend treating first? Do both, but I'm not sure that we would have to separate those. Zena is saying, Sculptra versus Subcision for old scars from cystic acne. Which one really gets rid of scar tissue? Well, first you would do the Sculptra. If it really is that it's pulled down, it's tethered, first you do the Subcision, actually, clear. First you do the Subcision, you want to break up that scar tissue, and then you could place that Sculptra on the correct layer. So that's what I would recommend doing. Hilla is saying, will you train me for aesthetics? I'm an NP and live in Irvine. You could always submit it for us. I'd be happy to help you out at some point. It's just that I'm really backlogged in my training, and a lot of people have reached out already. So this year is probably pretty much full, but maybe next year or something we could take a look and see. Sarah's saying, hello doctor, do you know any good doctor that can do what you do but in Belgium or near Belgium? I do not in that area, I'm sorry. I was referring earlier to somebody that was in Denmark, though. Denmark's not too far from Belgium, so if you want, you can consider taking a look at Dr. Emil over there. I'm not sure what kind of scars you have, anything like that, but he's somebody that's over in Europe there. Eva Nicole is saying, hello from Greece, doctor. I did a blepharoplasty and still have a huge scar. What do you recommend? Tricky, usually lasers, but it may take a few sessions, especially with your skin type. If you're a Greek, you gotta be pretty careful. You don't want to overheat the skin. I actually have a lot of Greek patients, actually, interestingly enough. Not so many in my area that actually come from outside of the state. And it's like, the Mediterranean skin, you gotta be very, very careful. Eye area, you gotta be exceptionally careful. So usually I would use more like a laser without much heat. Something like an erbium laser would work really well. For those asking, how do you book? You just go to my page, drqazi.com, and then you can schedule a consultation directly on there. I do virtual consultations throughout the day. I do in-person consultations as well. Just, wherever you are, we could be able to take care of you and help you out. Most of our patients come from out of state. More than 60% at this point come from out of state. So we also have a lot of patients from out of the country. So we'll absolutely would be able to help you out. So we could go through it really systematically to make sure that you feel comfortable with the kind of scars that you have and how I treat each of those individual scars. And I really zoom in there, if it's a virtual consultation or if you're in-house, I'll just go and really showcase to you what we'll do for each of these. So it's either way, we'll be able to handle it and give you a great game plan for the future. Sana, thank you so much. I look forward to seeing you too. All right, guys, I appreciate all of you. I will see you soon. And thank you so much, Pure Soul Gaming. Appreciate you. I'll finish with a couple more that were pending a few times. Alex is saying, Doc, is there a test on skin one can do to figure out if one can get hypo or hyperpigmentation of doing ablative CO2 laser? I mean, sure, you could try a test like behind the ear, for example, something like that. But realistically, the best thing to do is just to make sure the patient doesn't have sun exposure afterwards. The biggest thing is going to be sun exposure afterwards. Like that's the biggest thing. Of course, we're going to keep the laser settings as safe as possible, but sun exposure is so important. So make sure that you can minimize that so you don't get hyper or hypopigmentation afterwards. Our laser treatment safe to do during pregnancy. Never do any treatments during pregnancy. We'll always wait. So we'll never do that at all. I appreciate everybody, guys. Thank you so much. Really love the interaction on here, and I'll see you.